Pacific Islander Wellness Center has been around for 24 years, and we've been providing culturally competent, high-quality programs and services for the Asian and Pacific Islander community and the transgender community throughout the Bay Area.
We began as an organization that was caring for people who were living with HIV. In the 80s, there weren't any programs that were taking care of people who didn't speak English necessarily, or just took care of the cultural needs of Asians and Pacific Islanders. Since then, as our clients have stabilized and they've been getting better, we've added more and more programs. We also provide HIV prevention services to gay and bisexual men, Asian Pacific Islander, gay and bisexual men, the transgender community, and youth. And we also now do capacity building, which is helping other organizations across the country better serve the same populations, Asian and Pacific Islanders who are at risk for HIV and AIDS.
I mean, we've also expanded over the years, so not only doing capacity building and research and policy and advocacy, but as we've seen issues in our health issues in our community that affect us, we've expanded to do hepatitis B work. We do screening, vaccination, and treatment on site, and then most recently we expanded to open a free medical clinic. And so that's been a huge endeavor, but one that we've spent many years on, and actually just in March opened our doors to provide free medical care to the Asian Pacific Islander community and the LGBT community of San Francisco who are uninsured, underinsured, or have no access to healthcare. Client can actually receive services in their own language, which for many of our clients are non-English speaking. And so we are able to provide providers who speak many different Asian and Pacific Islander languages. So I think that's one. And then I do think there's just a lot of barriers just around how to access services. So many of our community members don't know how to go through the many hoops at times it takes, depending on your immigration status, depending on your income level, depending on just your life circumstance. Many of our clients it's too complicated. So part of our role is to break that down and to make it easier for folks to access. So one way is to make sure that they're accessing services within the community, but as many of those services that we can provide in-house, we feel that's our role.
Our success too has been our Trans Thrive program. It was a program that was run by UCSF in the past several years, and we took over the program. The city asked us to take over the program about 5 years ago. We had a long-standing transgender program that focused on the Asian Pacific Islander transgender community, and the city had seen that we had done really great work in that for many, many years, and so they asked us to take over this drop-in center that serves all transgenders of color in San Francisco.
Out of Trans Thrive, we actually began a program for transgender men, and it has been an amazing, a new program, but one that we're seeing is, again, a huge need, because there aren't spaces for trans men to talk about themselves with each other, to talk about, to have a safe space. And so we're able to provide that through Trans Thrive. And then we also have a transgender youth of color drop-in program that's been going on for several years now. I mean, San Francisco has always been, the model in every aspect to HIV. With respect to HIV, and for A&PI communities, we are sort of the center, San Francisco, in terms of programs and services, and we are one of the largest organizations that do the kind of work that we do across the country. For many years, we've been doing advocacy at a national level. With respect to Asian and Pacific Islanders and HIV, we're often overlooked and not called to the table, and so we've had to push ourselves to be at the table to say that actually our rates are increasing when we still have to push for better data collection in our country, and so we're at federal tables to make sure that data and surveillance and epidemiology are actually reporting us throughout the country, and then that services and programs are funded and resourced.
It struck me that you folks are, GRG West is so informed and focused and really trying to find out what the needs are of the community. And just, a group of really dedicated individuals who are doing this amazing job raising a ton of money for HIV services and LGBT services in San Francisco.
I just so appreciate the support from GRGR West, because it's a new source of support for us. And what I believe and what I love about the work that we do is that when folks support us, we really engage in long-term relationships. And I really feel like that's part of the value system for GRG West as well. And so that has been inspiring to me to see that there are organizations that are volunteer-run, that are doing such amazing work to provide a space for our community to have fun. And then with the purpose of giving back and supporting really, really important organizations doing great work.